Welcome to this video on blood. We'll be covering medical terminology, diseases, and surgical procedures related to blood. Blood is composed of cells suspended in a liquid called plasma. Cells like erythrocytes, leukocytes, and platelets make up 45% of blood volume. The remaining 55% is plasma, which includes water, proteins, sugars, and more. Blood is more viscous than water and has a temperature of 100.4 degrees Fahrenheit. It accounts for 8% of total body weight, with an average volume of 5 to 6 liters in males and 4 to 5 liters in females. Blood is primarily made up of blood cells, 45%, and plasma, 55%. Blood flows through the circulatory system. Its functions include transporting nutrients, gases, and wastes, as well as chemical messengers like hormones. Blood also contains white blood cells and antibodies to fight infection, and platelets for clotting. There are three main types of blood cells: red blood cells or erythrocytes, white blood cells or leukocytes, and platelets or thrombocytes. Red blood cells, also called erythrocytes, are biconcave and lack a nucleus. They consist of 95% hemoglobin, which is a red pigment. Normal red blood cell counts range from 4.7 to 6.1 million cells per mcl for males and 4.2 to 5.4 million cells per mcl for females. They have a lifespan of 120 days. Hemoglobin, or Hb, is the iron-containing protein in red blood cells that delivers oxygen to tissues. Normal levels are 14 to 18 grams per deciliter for males and 12 to 16 grams per deciliter for females. Low hemoglobin causes anemia, while high levels lead to erythrocytosis, meaning too many red cells. Hemoglobin breaks down into heme and globin by macrophages. Heme then breaks down into bilirubin and iron. Bilirubin is excreted, and iron is reused or stored. White blood cells, or leukocytes, are colorless and larger than red blood cells. 1 cubic millimeter of blood contains 7,000 to 8,000 white blood cells. They are formed in bone marrow, and their lifespan can range from months to years, depending on the body's needs. White blood cells include granulocytes and mononuclear cells. Granulocytes include basophils, eosinophils, and neutrophils. Mononuclear cells include lymphocytes and monocytes. Each type performs specific functions related to immunity and fighting infection. Platelets, or thrombocytes, are fragments of cells, not true cells, and lack a nucleus. They are randomly shaped and 2 to 4 microns in size. A normal platelet count is 150,000 to 400,000 per drop of blood. They are essential for blood clotting, forming a fibrin clot. Understanding blood groups is essential for transfusions. The chart illustrates which blood types can donate to and receive blood from others. For example, AB+ can receive blood from everyone, and O- can donate to everyone. Symptoms of blood disorders often include fatigue, shortness of breath, headache, muscle weakness, rapid heartbeat, and pallor. Blood disorders are categorized into erythrocyte, leukocyte, and platelet disorders. Examples include anemia and polycythemia for red blood cells, leukopenia, leukocytosis, leukemia and lymphoma for white blood cells, and thrombocytopenia, thrombocytosis, thrombophilia, and hemophilia for platelets. Anemia is a condition where people have a low number of red blood cells. Mild anemia may be asymptomatic, but more severe cases can cause fatigue, pale skin, and shortness of breath with exertion. Leukopenia is characterized by an abnormally low number of white blood cells, typically below 4,000 per microliter. Because white blood cells are the immune system's primary defense, this condition makes individuals highly vulnerable to infections. Thrombocytopenia is a condition with an abnormally low level of platelets or thrombocytes in the blood. Since platelets are essential for blood clotting, this deficiency increases the risk of mild to severe bleeding, including bruising and nosebleeds. Investigating blood disorders starts with initial screenings like a complete blood count and peripheral blood smear. Specialized analyses include coagulation tests, iron studies, and flow cytometry. Advanced procedures may involve bone marrow aspiration and biopsy, and genetic and molecular testing. Several medical terms are related to blood. Hematuria is blood in the urine. Hemoglobin is the iron-containing protein in red blood cells. Hemolysis is the destruction of red blood cells. Hemophilia is a sex-linked blood disorder. Hemorrhage is excessive blood flow, and hemostasis is the stoppage of blood flow. More blood-related terminology includes hematology, the study of blood. A hematoma is an abnormal accumulation of blood. Hematopoiesis is the process of forming and generating blood components. Common blood test abbreviations include AST and ALT for liver function, BMP for basic metabolic panel, BNP for congestive heart failure testing, BUN and CR for kidney function, CA for calcium levels, CBC for complete blood count, ANA for anti-nuclear antibody, and CK for muscle damage. More abbreviations. ESR tests for inflammation. HCT is hematocrit, part of the CBC test. HDL and LDL, are high/low-density lipoproteins. INR is a blood clotting test. RBC and WBC are red and white blood cell counts, TSH tests for thyroid-stimulating hormone. There are fascinating facts about blood. 1 ounce of blood has 150 billion red blood cells. A pint has 2.4 trillion. The human body produces 17 million red blood cells per second. It takes only 20 to 60 seconds for a drop of blood to circulate from the heart and back. Thank you for watching this video on blood disorders and terminology.